So we have a patient with abdominal pain that is described as starting near the umbilicus and later localizing to the right lower quadrant. Nausea and vomiting are present. Which condition is most likely? Would it be A, cholecystitis, B, pancreatitis, C, gastroenteritis, or D, appendicitis? Now, A starts with cholecystitis. And typically, when I'm looking for a test question with this emergency, I'm looking for the five F's, right? This test question really doesn't give us anything about the patient. Are they a female? How old are they? Were they eating fatty foods before this pain came about? It says nothing about it. And another thing that I want to remember is with cholecystitis, I have right upper quadrant pain, not right lower quadrant pain. B, pancreatitis, is something that I would see with a chronic alcoholic patient on a lot of exams. I would also see Cullen sign or Gray Turner sign. So there's bleeding associated with pancreatitis. Also, this pain would be radiating to the back. That is often seen on exams. C, gastroenteritis, is something that I would note with inflammation of the stomach and the intestines. Oftentimes in exams, they talk about recent travel. Maybe this person got sick recently with either a virus or a bacteria, and now they have an infection and they have a fever and they haven't been feeling well, nausea, vomiting, all that kind of stuff. In this test question, they did mention nausea and vomiting, but again, nothing about a fever. Doesn't really meet the criteria for gastroenteritis. Now, with D, appendicitis, this pain starts at the periumbilicus. Okay, so it starts at the umbilicus and works its way to McBurney's point. If you don't know what McBurney's point is, that is the right lower quadrant. If left untreated, you may also get something called a Rovsing sign. This is when you palpate the left lower quadrant and it causes pain in the right lower quadrant. Now, remember, these are all buzzwords that I look for in exams. I take a lot of different tests. And if you know the signs and symptoms and you know what to expect on the exam, that's what's going to make it so much easier for you to answer these types of test questions. The answer here is D, appendicitis.